Virginia, here with Miss Jennifer today from BrightView, right off of Mount Cross Road, close to Walmart, right here in the beautiful city of Danville, Virginia. So Jennifer, you want to introduce yourself?
Sure, thank you, David. Hi, I'm Jennifer Miller. I'm the Community Outreach Manager for BrightView Health. We opened our doors in Danville the very first part of May of this year.
Okay. Awesome. So I try to cover Danville, Virginia, not just real estate, but we try to introduce people who live here, who are relocating to the city, to services, to where to eat, where to play, where to sleep, things to do. And sometimes we ourselves, or we know a family member or a friend who may be struggling with addiction, right?
Yes.
And that is you all's specialty, correct?
Yes, it sure is.
So can we start off, where are you from and how long have you been in Danville? And if you left, what brought you back?
Okay, actually, I was born and raised here in Danville.
Okay.
So I've actually never left. I've been here all my life. I've worked in behavioral health in some form or fashion for the last 25 years.
Okay. Now, as far as BrightView is concerned, what kind of was the story behind opening up the BrightView Health as far as servicing folks who deal with addiction? Kind of why did that pull you in to join BrightView?
Okay, great. So BrightView started actually in Ohio, and it was in 2015 when the first doors opened. A gentleman by the name of Dr. Ryan was an emergency room physician in Cincinnati, Ohio, and he had started to notice that there were a lot of people that would come in on the ambulance. They had overdosed. They would Narcan them and hand them a piece of paper and say, here, go make an appointment somewhere and street them. And then, unfortunately, they would, usually return pretty quickly. Or, unfortunately, they wouldn't return because they overdosed and died. And so Dr. Ryan really wanted to kind of reinvent the wheel, if you will. So he wanted to form a place that was welcoming, non-judgmental, with immediate access to life-saving care.
Okay.
So he developed BrightView, and all of these years later, here we are.
Awesome. Now you guys opened up here May 1st.
That's correct.
Okay. So what brought you onto the BrightView team?
Okay. Well, actually, I had struggled with leaving my position prior because I have always worked patient-facing, always served directly. So this was a little bit of a change for me because I'm not providing any direct patient care. But I'm out in the community trying to share the information about BrightView, make sure that everyone is aware of our services. Eventually, it was a really easy decision because BrightView really does what they say they're going to do. It's a great welcoming environment. We really do put the individuals first, and I like that.
Awesome. Okay. So I know we had taken a tour earlier of the facility. So say I have an issue.
Okay.
And I come into the office. Can you walk me through treating me, what that process would look like?
Sure, absolutely. So one of the things that everybody really does need to know is that you don't have to have an appointment to come into BrightView. We take walk-ins Monday through Friday. We open at 8:30 in the morning. Love for our new patients to be here by 3 so that we can get everything done. Sometimes things happen. If you get here after 3, that's okay. We'll still see you. You just may have to come back additional days to finish everything. So initially you come in, there's going to be some paperwork. The first person that you'll see is our medical assistant. She does blood work. We can draw labs here. We do a general health screening on every new patient to make sure that if they have any underlying medical conditions that they're not aware of, we can link them to services in the community that they can start to follow up with medical care.
Got it. Okay.
So after that, then they will see our medical provider. Cynthia Barker is our nurse practitioner here. She's wonderful. Patients really, really like her. So she does a very, very thorough substance use disorder assessment on each individual.
Okay.
After that, then they will meet with their care coordinator who does all things case management. So some examples may be if they're uninsured, she can help them apply for insurance. If they need to get their photo ID but they don't have their birth certificate, she can kind of help them with that process, things like that. And then finally, they will meet with their individual therapist. We have 2 clinicians here now. They offer both individual and group sessions.
Okay, because we're in one of the group rooms now, correct?
We are.
So in the group session, because you see it on TV.
Right.
It's like, hey, my name is such and such. Is that kind of how, do group sessions really function that way?
Yes and no.
Okay.
So, our group sessions are really more about support for the individuals. I think a lot of people really benefit from having a room full of people that really do know their struggle because they themselves are dealing with the same issues. This group setting is all about support and encouragement from each other. Do a lot of educational things during the group, as well as kind of start to delve into some of the other issues that are underlying. Because, if anyone is familiar with addiction is very closely related to trauma, depression, anxiety, those types of things. So they also kind of start to talk a little bit about that as well. And also coping strategies, because it's tough out there. And so when you're newly in recovery, it can be very difficult. So they talk a lot about those coping strategies as well.
Okay. Do they do kind of like accountability partners during the sessions?
That is a great question, and I don't know the answer to that, but I'll absolutely ask our therapist who runs the group.
Okay. Yeah, I was just curious, like if you and I were here and we had, say, I dealt with cocaine, maybe alcohol for you. It's like, hey, can you be my accountability partner? Give me a call if I'm struggling.
Right.
Okay, that's awesome.
Yeah, great.
And you said you don't have to have insurance.
You don't. So, just so everyone will know, we do accept all insurances. Medicaid covers us, Medicare, as well as most of the private insurances.
Okay.
However, at BrightView, we really believe that anyone who wants recovery deserves it. So we will never turn away anyone for their inability to pay for services. If we have someone come in that's employed but no insurance, we have a sliding scale fee that is based on their income. However, if we have someone that comes in that's unemployed and uninsured, we do have a foundation that we work closely with, and we're able to apply for funds to help offset the costs for that individual.
That's awesome.
It is. It's great.
That's awesome. I know you said earlier when we were talking that if somebody came in, they weren't sent away to have to come back for an appointment. Correct?
Yes, absolutely. That is also very, very important to us. We have actually same-day treatment, not just same-day access to an appointment. So some places, you may come in, you'll meet with someone, do an intake, and then you'll have to come back and see the provider at a later date. We really believe here at BrightView it's so important as soon as somebody makes that decision to walk through our doors, because that's a scary decision sometimes, that we really want to get started immediately. And so, yes, they actually see all of those individuals that we mentioned earlier, the nurse, the medical provider, their counselor, and their case manager on that very same day that they walk through our doors. If they are going to need medication-assisted treatment, then they can actually start medications the same day.
Really?
Yes.
Wow. Okay, and technology is big here too.
It is.
Because if nurse practitioner isn't here, they can still have access to somebody. Can
Absolutely.
you tell us about that?
Yes, thank you. So we really don't want getting help to be a burden to the patient. So, for example, yes, if our provider is out for a family emergency, we don't want to have to tell the whole entire day of scheduled patients, we're going to have to reschedule you.
Okay.
So we actually have the ability to use telehealth, and we can kind of zoom in with one of our other sites, and a provider at another site will be able to see that individual that day. Some individuals don't really like that. They want to wait for their provider. They certainly can do that as well, but it is an option.
You all are working on something else in the office too. I think you said it was your in-house pharmacy.
Our in-house pharmacy.
Yes.
We actually are. We're really excited about that. It's not open yet. Hoping that by the end of the year, we may be ready to go. That's important for a couple of reasons. Again, we're all about getting treatment easy for people.
Okay.
So having a pharmacy here is really convenient. A lot of people, may struggle with getting transportation. And so having a one-stop shop, they can see their providers and then get the medications that they need in the same place. Also, as unfortunate as it is, a lot of people who may be taking medications that treat the disease of addiction, we get a lot of feedback that they don't feel comfortable going into regular pharmacies and picking those medications up. They feel judged.
Right.
And so being able to get their medications here helps them to alleviate a little bit of that anxiety surrounding their medications.
Got it. Okay. So there is a career and job fair coming up November 1st.
First, yep, Tuesday, November 1st.
From, I think,
9 to 3.
9 to 3. Will you all be there?
We absolutely will.
Okay.
DCC is actually hosting, it's a job and resource fair. It's actually going to be held downtown at the community market.
Yep.
And we are going to have a ton of employers there, as well as a lot of resources in the community as well.
Okay.
So yes, BrightView will absolutely be there. So if you go, stop by my table and say hello.
Will y'all be looking for hiring for positions? And if so, do you know which positions will be on the docket for hire?
Yes, so we are always hiring. We're actually getting ready to open a few sites in North Carolina, which will be our first sites in North Carolina. So
really?
There are job opportunities in a lot of different areas. For our Danville office, we're always on the lookout for clinicians.
Okay.
License is great, or case managers, front desk. There's a lot of different types of employment opportunities with BrightView.
Okay. Now, sorry to go, I guess, just digging a little deeper.
Okay.
With the clinicians, what type of clinicians? Because I have no idea what. But as far as a clinician, will they be serving the patient, or what would that
Yes.
look like?
So clinician, essentially a counselor.
Counselor.
Right. Okay. So the words are interchangeable.
Okay.
We have clinicians that are master's level, have their CSACs or their LSACs,
Okay.
which is a specialty for addiction. We have a licensed psychologist here that is our clinical director.
Oh, wow.
So he oversees all of the clinical stuff with the counselors and the case managers.
Perfect. Okay. Well, Jennifer, thank you for your time. Again, could you tell everybody where they could contact you, whether it's by phone, email, online, and physical location?
Absolutely. So, BrightView in Danville is located, as you said earlier, at 480 Mount Cross Road. We are right beside Murphy's gas station, kind of catty corner from the big Walmart. If you're from Danville, then you probably know us as the old mattress store,
Yeah.
which is the first thing you said
Yeah,
when you got
the old
here.
mattress store.
Right. So our hours are Monday through Friday, 8:30 until 5.
Okay.
I don't have an office here on site, but people can easily contact me. My email address is j.miller@brightviewhealth.com.
Okay.
And you can also reach me by cell phone, 434-250-8113.
Awesome. And this is David Totten with eXp Realty, here with Miss Jennifer Miller at BrightView Health. If you are thinking about relocating to the area, give me a call. I can definitely get you in touch with Miss Miller. If you or someone you know is struggling, because they are here to help, and they see it as soon as you walk in the door, you're provided services. So Jennifer, thank you again. It's good to see you.
Great to see you,
And,
David.
You all, please like and subscribe to the channel.
Yes.
And if you need Miss Jennifer, please reach out.
Great.
Her contact information will be below in the description.
Excellent.
Thanks,
Thank you so
Jennifer.
much, David. I appreciate it.
See you guys.
Bye-bye.